All right, we're going to start welcoming people in. Happy Tuesday, everybody. I know near me it's a rainy, gloomy Tuesday. We will give everyone about another minute to log in and join us, and then we will go ahead and get started. A few more people jumping on. Welcome, everybody. Give another like 30 seconds in case everyone's like me and a little behind today, a little tired. We'll give everyone another second to jump on.
But it's Taco Tuesday. Everybody has to be
Yeah.
happy today.
All right, well, welcome everyone. See a couple more people. We will go ahead and get started as people continue to join us because we are, of course, on a short time period with our 30 minutes today, but want to go ahead and get started. Hello to everybody. I'm Andrea Young, the ECAC parent educator and communications lead. And today I am happy to have Francisco Guzman, minority outreach coordinator with the Division of Child and Family Wellbeing, Whole Child Health Section with the North Carolina Department of Health and Human Services. I always find that's, you guys have a mouthful with your titles. But today he's going to be joining us to talk about changes in Medicaid that are affecting all populations in North Carolina. So without any further ado, I go ahead and send it over to Francisco.
Thank you, Andrea, and thank you very much to ECAC for the opportunity today. I hope the audience is not changing the channel because I'm really sure that maybe you have heard about all changes that Medicaid is doing in North Carolina since last year. I want to make a refresh for those who don't know anything about the changes. And maybe today you will learn a little bit more in some slides that we are gonna present today. What do you need to know about NC Medicaid? Of course, as Andrea mentioned, NC Medicaid is for a lot of population in North Carolina. And of course, you may know that we receive a good news last year, starting on December the 1st, NC Medicaid was launched and is a healthcare coverage as other insurance, of course, with some particularities, but this NC Medicaid, the expansion will cover people between 19 and 64 years with higher incomes. What is very important that people know about this, because this specific population from 19 to 64 never figured out in the Medicaid era, and now we have them. What is gonna be covering the Medicaid? The Medicaid expansion will cover those who have some tricky situations about health. Of course, 19 to 64, and will pay doctor visits, yearly checkups, emergency care, mental health, and a little bit more. There are 3 requirements that there is a need to know. You may live in North Carolina, no work, you need to leave, because sometimes people get confused. If you are working in another state, that is perfectly fine, but at least you have a residency in North Carolina, you are good to go. Age between 19 and 64, and you are a citizen. Now, there are some exceptions, because not just American citizen can apply for a Medicaid expansion, and I will show you through the presentation all the exceptions that we have. Remember something from here to the end of the presentation. Anyone can and should apply, but there are gonna be some eligibility rules to get the Medicaid expansion. We will have a lot of help because if you're eligible for Medicaid expansion and someone in your community is eligible, they may have services as a primary care, hospital services, maternity and postpartum care, prescription drug benefits, behavioral health, preventive and wellness services, dental and oral health services, and medical related devices. Andrea, I don't know if you are related with the dental care in our communities, but that's one of the first nightmares that we have out there. The dental care is very difficult to find, even though when we have Medicaid, is kind of tricky to find. And if we have someone in our family with a special medical needs, it could be a double challenge to get a dental care. But fortunately, with Medicaid expansion, dental and oral health services will be covered as well. Now, make sure that you can understand this simple chart. Maybe you're not a math person, maybe you don't like the numbers, but let's work a little bit here with some colors. There is a phrase that is called federal poverty level. This federal poverty level for Medicaid expansion is going to be 138%. The 138% is this simple chart. Remember, depends how many people are in your family. It depends how much is the monthly income that you have to earn before taxes. Now, sometimes when people see in a flyer these numbers, they say, oh no, you know what? I'm a family of 3 and I'm doing $3,100 and it doesn't match with the chart. What I'm doing as a recommendation is, please, if you feel that you are maybe 200, 300 above the monthly income, you may try it because we don't know how are your expenses or how were your expenses some months before, and maybe 8 months, 9 months before you were having a different job and different income. Now, if you double the size of these amounts, maybe you don't have to waste time in a DSS office or doing it online. But if you have like a couple of bucks, a little bit more, you may try. Now, my colleague was here in this Tuesday session last week, and she mentioned perfectly about the federal poverty level for children and youth. You can see here for children, we have a 211% of the federal poverty level. Here are some examples, and I'm gonna put you a chart for children. This is for pregnant women and other adults over 65, people with blindness, people with disabilities, as limits also apply. Here with pregnant women, we have 196. And here for the last category, we have 100%. I believe you will have plenty of questions. I agree with Andrea that we are going to leave questions at the end, but please don't hesitate to put your questions on the chat. If I don't have the answer, I may contact you right away tomorrow to give you an answer. Now, let's go to the other slide because I just want to make sure that you totally understand that for children and youth with a NC Medicaid, you have a totally different story for Medicaid expansion. Children and youth, 211%, Medicaid expansion, 138%. And these are the new rules starting on April the 1st, 2024. That's something that my colleague presented you last week regarding from 0 to 18 years old, because Medicaid expansion is from 19 to 64. As the same way, if you guys or your communities haven't applied to Medicaid for children and youth, let us try. I mean, you will not receive any penalty if you're not allowed to get Medicaid. Simply, you will receive a letter saying if you are allowed to get Medicaid or not. This slide is very critical because there are a lot of categories, immigration categories, that can be able to apply for Medicaid. I'm not a lawyer. Maybe you are not a lawyer. In case you are an immigration lawyer, maybe you are more savvy than us, because these immigration categories allow to apply for Medicaid. But for example, when we have a person who has a green card and is a green card holder, this person can apply for Medicaid, but there are different categories that can apply right away, but the majority of them, when they are green card holders, they have to wait for 5 years. This is a must. If you're a green card holder, you may wait for 5 years. Now, there are a lot of community here that are asylees or refugees. We have plenty of refugees around North Carolina, but if you arrive to the country as a refugee or asylees, you will be able to apply easily to Medicaid. There are another nationalities as Cubans or people from Haiti, or maybe victims of trafficking. Some of the people have identified as T visa holders because they are victims of trafficking. They're allowed to have Medicaid. But please read by yourself all of these immigration categories. I'm not telling you that you're gonna be an expert. What I'm telling you that if somebody arrives to you or someone in your family is saying, oh, I entered to the country with this category, am I allowed to apply? Please make sure that they go directly to DSS office or they apply online, because depends the category, it depends if you're gonna be allowed. And later on, we are gonna see some examples about different categories that are in North Carolina that maybe you've been identified or maybe you work with them, depends the situation. Just make sure that if we don't know anything about categories, let's ask the professionals who do the applications and the ones that can inform us about it. Now, all the time when we pay a private insurance or maybe an insurance from the Affordable Care Act, we have to pay something by month. At this time, for Medicaid expansion, we don't have to pay anything. For Medicaid expansion, the highest copay will be $4 in case you need it. Now, people cannot believe that. People out there says, oh, Francisco, that is not true. I haven't had any experience with insurance before. Okay, because maybe you haven't had Medicaid expansion before. But Medicaid pays the cost for most health care services. And remember, if you have a private insurance, you are allowed to have both. If your requirements are allowed to have Medicaid, you're allowed to have private insurance and Medicaid. But the first insurance that will take care about your health will be your private insurance. And then Medicaid will pay the rest of the payment. Are we good, Andrea? Good. Now, it is important to know that at this time, in this 2024 May, we have 5 options to apply for Medicaid. I'm going to start with the one that maybe if we are not patient is not the one for us, but this is still a possibility. You can call to a DSS office to try to make your application. I've been with families through the phone and it takes maybe 30-45 minutes. When we get somebody, it's very helpful. But if you are not patient, don't take the phone. If you see smiling faces at the offices, you may go to a DSS office close to you. Remember, if you are trying to apply for Medicaid expansion or for Medicaid for children and youth, or for adults with disabilities, or for pregnant women, you can visit the agency DSS, Department of Social Service. Every county has a Department of Social Service. In your county, you may follow your jurisdiction. If you are living in Guilford County, you cannot go to another county because your address belongs to Guilford County. You may go to DSS office, Department of Social Service in Guilford County. That's an example. Now, if you don't know anything about English, because maybe you may arrive 3-4 months, the Department of Social Service, even in the office and by phone, they will help you with interpretation service. If you don't know English, they will help you with interpretation service at the office or by phone. Just remember, interpretation service, 3 people are in the party: the interpreter, you, and the staff of the SS office. Now, some people still like to use the paper application. I don't know if you are the type of person that like to write a lot. Just make sure if you use the paper application, is because you are reviewing the application 2 or 3 times. Because if you have any mistake, the application can go back and forth to your house. And we don't want to have like a lot of application be corrected. And finally, we have these 2 processes to apply. One is the e-pass. I don't know if you have heard about the e-pass. This e-pass that is being very popular in the last 7-8 months is been helping a lot of people to apply online. If you are an online person, the e-pass will help you a lot because everything is gonna be in your computer, in your phone. Just make sure that you have internet, make sure that you know how to manage computer. Now, if somebody does not have access to internet, you can help somebody to deal with e-pass. You can be a helper. Just make sure about the sensitive of the information, because a lot of private information must be needed for the e-pass. And finally, since February the 1st, 2024, we have the healthcare.gov. There are some navigators around North Carolina, NC Navigators. They don't charge anything, and they are allowed to do the process in case you haven't heard anything about Medicaid expansion. Just I want to clarify, navigators are helping for those who are getting the Affordable Care Act, the Obamacare. But if you are rejected from Medicaid, the navigator can help you right away. But if you haven't tried any Medicaid application, the navigator now, since February the 1st, is allowed to do your Medicaid application. And if you are rejected from Medicaid application, that navigator can help you to do the Affordable Care Act application. 5 in your hands. There is not excuse that you are not able to apply for, right? And make sure that the information that you are provide is correct information, because if there is something that the social worker doesn't understand, they will contact you back and try to figure out what is the correct answer for the application. Now, we still have a lot of barriers to enrollment, even though for people from here that born in North Carolina, they are still sometimes confused. What are the lack of information that we have? We have people who doesn't know how to apply, people who don't think that they are eligible, or they don't realize that the benefits are for them. And of course, for our vulnerable communities, or those who maybe mom and dad, they are not a US citizen or they are not a resident, they have immigration concerns that is called public charge. If I'm a person who doesn't have any legal status, maybe I'm not gonna be free to enroll my child to the Medicaid because I think, or somebody told me, or an attorney told me that I'm gonna be public charge. Just when I need to clarify this, because we've been finding a lot of people out there as attorneys, immigration attorneys, saying, hey, don't apply to Medicaid. It's not gonna be benefit for you. Hey, don't apply to a WIC. Hey, don't apply for a SNAP for the Food and Nutrition Week, because it could be not a good step for you immigration process. Please take out that sense and that knowledge, because it's not true. You still are able to get Medicaid if your mom and your dad are not American citizens or green card holders, but they have kids who are eligible. You still can do the process. Pass this message to your communities, because we have a lot of people in problems because they don't understand this information in somehow. Now, during the process of Medicaid, they're gonna be contacting you or your communities in different ways: text, emails, phone calls, or letters. But never, ever somebody from NCDHS or DSS, from Department of Health and Human Services or Department of Social Services, will request any money to apply or any PIN number to proceed with the process. Sometimes out there, we've been hearing some fraud in the community. We just want to make sure with you guys, nobody from Department of Social Services or the North Carolina Department of Health and Human Services will contact you asking you for money to apply. They may contact you to clarify some information that you add in the application. If you don't feel comfortable, you can you can track the call, or you can go directly to the office as well. Perfect. Now, Medicaid expansion has a lot of updates, okay? We already talked about this lovely update that the navigators can do the application because they are doing the Federal Facilitate Marketplace. And of course, the applicants that are enrolled directly in NC Medicaid have been receiving some letters. We're gonna provide some information about family planning, but thousands of people were receiving some letters, informed them that they were eligible for Medicaid expansion. But even though they received the letter, they don't believe in Medicaid expansion, or maybe they left the letter down there and they don't follow any instructions about what they have to do. I want you to mention that we have new material available that is there. This material talks about a lot of topics. We have material to talk about Medicaid eligibility, emergency Medicaid. We will talk about later about this. Medicaid for children when a parent is undocumented or without legal status. How to apply or receive a Medicaid, some public charge. Remember that I talk about public charge, you can learn more about. And these flyers are totally free in our website. Please make sure that before you finish this presentation or before you finish your week, you visit our website and you can figure out all the flyers that we have. Now, we have as well a site with more than 45 questions. And these questions, Q&A answers, are for you, are very flexible answers, very easily to digest, because there are the questions that the people out there are asking every single day. Make sure that you go to these immigration eligibility questions, that you can find out much better who can apply and who cannot apply. Surprise, we have our Medicaid expansion flyers in different languages. These are the languages that this specific flyer who is informing about Medicaid expansion: in Chinese, in Arabic, in Hindi, in Hmong, Korean, Russian, and Vietnamese. All of these languages are the most popular languages in North Carolina. I mean, we have more than 340 languages, but these are the most popular. Please make sure that you share with your communities out there about these new flyers in different languages. Now, I have a question for you, and let's play a little bit with your tongues up and tongues down. Are undocumented immigrants eligible for Medicaid? Is there any way that you can give me a thumbs up, a thumbs down? What do you think about that? Am I seeing something, Andrea, here? Oh, thumbs up. Okay, I see one thumbs up. What about the other ones? Oh, perfect. I believe you are totally right. Let's see the answer. Oh. Yes, undocumented immigrants are eligible for emergency Medicaid. It's not Medicaid expansion. It's not Medicaid for children and youth. It's not Medicaid for pregnant women or people with disability is Medicaid for undocumented immigrants. However, undocumented immigrants are not eligible to enroll in federal health coverage, okay? They cannot apply for any ACA, they cannot apply for any private insurance. If we have any specific situation with migrants are involved, people without legal status, undocumented people, and they have an emergency, they're still allowed to get emergency Medicaid. It's the same application. They can do it online. They can do it through the social worker at the hospital. They can do it at the office, but with the exception of Medicaid, emergency Medicaid. And I put my alarm just to make sure that I have 5 minutes left, right, Andrea? Undocumented immigrants are only potentially eligible for emergency Medicaid or label and delivery services. Emergency Medicaid could be a car accident, something that is an emergency. Quickly, are farm workers in your area with an H-2A visa eligible for Medicaid? Actually, farm workers with a lawfully present status are potentially eligible if they are just pregnant women or child under 18. But if they don't have these criteria, H-2A workers may apply for the Affordable Care Act. They are not allowed to have Medicaid expansion. Other non-immigrant visa holders, as a tourist, U visa, are eligible for Medicaid. There are potentially eligible and exemptions for the 5 years, but people applying only for emergency service are not required to provide documentation of immigration status. If you have family members or if you have community members that are here as a tourist or as a student, they are not being required to have a documentation to prove. They are not going to be allowed for Medicaid expansion, but they may be allowed for emergency Medicaid. Are DACA recipients allowed to apply for Medicaid? Yes or no? No eligible for Medicaid, but thanks that in November 2024, the Deferred Action for Childhood Arrivals, DACA recipients, will be able to enroll in the Affordable Care Act coverage. More information to come. Can people with temporary protected status apply for Medicaid? The answer is no. People with TPS cannot apply. However, they may be eligible for emergency Medicaid or for the Affordable Care Act. Every single category could have an exemption, okay? Make sure that you can figure out that difference. Maybe all of you know what is a family planning Medicaid. Family planning Medicaid provides reproductive health care at no cost to people with incomes up to 195%. Will be limited family planning program enrolled in Medicaid under the new rules? Is totally directly, yes. People already enrolled in Medicaid's limited family planning program who are eligible have been automatically moved to Medicaid expansion, but not everyone with this program is going to be allowed to have Medicaid expansion. The $1,000 question, can I have Medicare and receive Medicaid expansion? No, but another exception. Some people who have Medicare can be eligible for other existing Medicaid programs. For example, people who are disabled and are age 64 and under may be eligible for Medicaid through disability coverage. Make sure that you can inform this slide. And we have a lot of things to do with public charge. These are things that are not related with public charge. Please make sure that you can focus that these programs are not going to be public charge in North Carolina. I'm talking about North Carolina. But we have just only 3 benefits that are considered negatively if you are submitting immigration applications. The SSI, temporary assistance for needy families, and Medicaid only if used for long-term hospitalization or nursing home care. Nothing more than this, okay? But again, it's case by case. I'm saying that if you have a SSI and your child is from is a U.S. citizen and you are going to apply for Medicaid, nothing to do. I mean, just remember, not all the cases are the same. If you are not allowed to have Medicaid expansion, and if you're not allowed to have Medicaid for children and youth, or you're not allowed to have Affordable Care Act, you may visit community health centers. They can help you to find services, health services for a sliding fee. And this expansion will improve access to mental health services or substance abuse treatment. The answer is yes, because other states with Medicaid, with expanded Medicaid, the suicide rates decrease and access to substance use disorder treatment increase. And just I want to tell you that NC Medicaid for More People is here in North Carolina, and it is a reality. Please, if you have any question, I'm not the person who is doing applications. I'm not working with the Department of Social Service. I'm working with the Division of Child and Family Wellbeing. My intention is to feel deeply with your communities. If you want me to do any English presentation, any Spanish presentation, please don't hesitate to reach me out. I'm the kind of guy who is traveling around the state. I'm the Minority Irish coordinator statewide for presentations everywhere, any place you think. Thank you very much.
Thank you, Francisco. I know that was a lot of information to put into 30 minutes, so we appreciate your time. We will be sending out this presentation to everyone that attended so they can have all that information and all the links that you provided. I do see we have 2 questions, but right before we get to that, I'm going to launch our poll. If everyone can go ahead and answer some of these quick questions. We are, because of the grants that we work on, required that to report back to them if what we're doing is useful, relevant, and of high quality, and we really appreciate your feedback. So if everyone that is an attendee can quickly do that, and then we will, while you're doing that, we'll get to these questions. Francisco, do you see those? Do you want me to read them out?
No, actually, I can see them. One instance, for the household size family, how does it work if you have a college student under 25? Will that college student have to apply for their own Medicaid insurance policy, or will be parent continue to apply for them as a dependent? Actually, no, they have to apply by themselves. The majority of the time, if the college has any job, that is going to be the kind of job. Just remember something. Gigs out there as a Uber, or if you're a waitress or something, can count in Medicaid expansion, okay? Make sure that you can figure out that. And if you have a student, it's a must that students can apply by himself, by herself. Second question, for the behavioral health part of Medicaid, does this include therapy, psychology, and psychiatrist? Is this a referral process from a private provider? Also, how does this work in regard to children? If your child is having certain emergency behavior issues, okay, if we are talking about children and youth and Medicaid, yes, you will follow the rule of your vendor. And you may know, I mean, in July 1st, Taylor Plan is coming, and a lot of the kids, children, and youth are going to be passing through the regular Medicaid to the Taylor Plan. If you have an emergency with a person who is not documented or it doesn't have any legal status, that it has to be an emergency in the emergency room that can cover regularly. If you have therapies to get with a person who is undocumented, that is not emergency Medicaid. We need to find somebody else that can help with a sliding fee or other kind of process. But yes, if your child is enrolled in Medicaid, all these psychologists and psychiatrists are going to be included in the Medicaid, even for children and youth, even for Medicaid expansion as well. And of course, I would like to, if you have any plan, any vendor from Medicaid, make sure that you contact them, because sometimes behind the card of the insurance card, there are a lot of services that we don't know. And when we talk with a representative, we discover a lot of things. I've been having calls with families, one-to-one with different vendors, and it is glad to hear that they have extra services to offer that maybe we don't know.
Great, thank you. Are there any other questions? I know we're a few minutes over, but we can always take another question if anyone has one. If not, I want to thank everyone for attending today. Next week on Tuesday, the 21st, we will have Linda Fields with us, who is the director of the UNC CARES program. And she will be talking about rethinking guardianship, exploring less restrictive alternatives. So be sure to join us next Tuesday at 12 o'clock. And if there are no more questions, I wish everyone a great day. Thank you so much, Francisco, for joining us, and we will see you again next Tuesday.
Thank you, Andrea. Please spread the message. See you around.
Thank you, everyone.